Good evening, ladies and gentlemen. I'm president of AMP Alternative Medical Products Inc. as well. The Inc. is our stock-listed company in Canada, and I'm going to talk with you about prospects of medical cannabis extracts in the German market. First of all, I would like to introduce our company briefly to you. We were founded in 2018 by two Canadian private investors and myself. We then applied for EU-GMP certifications and did set up our process as an importer and wholesaler of cannabis medical products in Germany. We were initially dealing with producers from Canada because our two main investors are located in Vancouver. And we come to that later. On the road, we also did contact producers from Europe. We were stock listed in 2019. We received all our licenses in the same year, and we started to expand our portfolio by imports from Canada and from Australia, as well as from Denmark in the near future in 2020, 2021. We did build up sales team, so-called key account managers in Germany, Pharma-Referenten, who serve in all regions of Germany now. And we are on our way to build our own brand for flowers as well as for cannabis extracts. I did choice to talk with you about extracts today because I think the importance of extracts in the medical cannabis market is still totally underestimated, and all of us should have a closer look on that product. So what's my agenda for today? A very brief introduction into history of cannabis extracts. We will shortly talk about advantages and disadvantages of cannabis dosage forms. We will have a look at the current market situation for extracts in Germany, at new launch product extracts, as well as on the prescriptions by diagnosis. Cannabis Dilemma stands for what I found out about the German situation for cannabis extracts. We come to that later. And then I did look at other countries which help us to compare development and situation. And I found out that compared to Germany, there's a very good actual detailed databases for the usage of extracts for medical purposes in Australia. That's why I did choose that country to compare with the development in Germany. And we will talk about research activities in that country at the end of my presentation. History of medical cannabis. Actually, when the medical use of cannabis was started, it was not only the flowers, it was mainly hemp tinctures. Also in 1900, there were hemp tinctures sold in America, but also in Europe. You can see one bottle from Wisconsin and another label of a German company, Merck, which introduced hemp tinctures in the market. Then, of course, something changed. Many years later, something changed. The Single Convention on Narcotic Drugs of 1961, we talked about that today. And that, of course, had a, first of all, negative impact on the distribution of cannabis medical. There were bitter comments before, like this guy from America, but the main step towards a decline was the UN Convention in 1961. What do we have now? We have, of course, different dosage forms. All of them have their justification. For example, full spectrum extracts with CBD is helpful to minimize THC side effects. We have flowers which are compared to extracts slower in the onset of actions. They are very good tolerably, and compared to extracts is more difficult to have the right dosage findings. For last not least, all you know that we have dronabinol, a semi-synthetic pure THC without CBD terpenes, which allows standardized applications. Where do we stand now in Germany with extracts compared to the usage of dronabinol, the usage of cannabis flowers, sativix? Cannabis extracts still play only a minor role in Germany compared to the other products on the market. Dronabinol still dominates the evaluation, overrepresented in all indications with 65 to 85%. Sativax is mostly used for spasticity. Cannabis flowers were used for other indications like pain. But you can see altogether extracts mainly are used for pain treatment, but they do not play a major role still in the survey. The sales development also shows that there were only small increases for sales of cannabis extracts, but in 2020, you can see it in the chart, in 2020, at the end of the year, the sales of extracts in 1 month doubled to at least 1 million euro monthly. So it shows a steep increase in the last recent months. So who is reigning the market? Everybody knows that Tilray is the biggest company in the extracts market in Germany, as well as in other European countries, as far as I know. Botanical has a significant market share, and all the others like Aurora and Canaxan have only a very, very small market share. What are the expectations? Based on some sellout data, we see that the sales of cannabis extracts, provided that the regulatory conditions will not change dramatically in the next 3-4 years, at least will more than double. That's the expectation. You can look at the growth rates linked with the products. You see Tilray did have and still has the biggest growth rate, followed by Botanical and Aurora. The others are negligible still in the market. In Germany, there were only few extracts registered until 2019, but in this year already another 22 extracts were listed. So now a total of 27 extracts are registered in Germany, which also shows that the market access of extracts will take up with speed. Yep. Now we look at the indications the extracts are prescribed on. It's mainly pain, followed by neoplasm and specificity. And later on, we'll see this is also the case in other countries. What we have in Germany is only a few research activities in the sector of cannabis extracts. We had a deeper look into it, and as a matter of fact, there are only 2 studies which really did come to some finished results. One is an observational study of current treatment practice in order to investigate the relationship between cannabis medication and indication. And the other one is a drug use disorder study, which was recently finished. This is what I call a cannabis dilemma. We have only very few studies on fundamentals and endocannabinoid system in contact with extracts. We have a lot of application studies and clinical trials in other countries like in Israel, USA, South America, and Australia, but not yet in Germany. What is the reason and the background for that? I think one of the reasons is that the health insurance companies in Germany, the statutory public health insurance companies, at least in Germany, do not recognize many diseases that can be treated with cannabis. Doctors are not trained in cannabis therapy during their educations. It's still too few doctors practice cannabis therapy. Patients, of course, are looking for experienced doctors. And on the other hand, the complicated applications form for the reimbursement is very time-consuming. That's why a lot of doctors don't like to do the job. Also, what we see, at least if you look at the public health insurance companies, roughly 40% of the applications for reimbursement still are rejected by the health insurance companies, which of course does not motivate the doctors to deal with that, because worst case, they are responsible for the expense. Yeah. What I did, as there are not a lot of data in Germany, I looked at other countries, and as we have good contacts to a company in Australia producing extracts, we later on will come to that, we had a look at Australia. There's a comparatively good databases and also a quite strong market for extracts. The extract market in Australia shall hit some 200 million Australian dollars this year, which is something like 126 million euros, compared to Germany, a big number. Also, the patient numbers in Australia have been growing much faster than in Germany, and we have a much better database which relates prescriptions to diseases. We can see, whereas in Germany, dronabinol and other don't play a big role, but not compared to Australia. In Australia, oils and other extracts reflect 75% of the total market, which is a much bigger market share compared to the German market. Also, the number of products which were introduced in the Australian market recently was much bigger compared to the German market. Chronic pain also plays a role with respect to diagnosis and prescriptions. That's comparable to Germany. And I picked up one company because we are dealing with that company. I know them quite well. It's called Little Green Pharma. That company is doing a lot of clinical trials in cooperation with Sydney University. It also was awarded in January 2021 by the French government, and it is taking part in a big research. Up to 3,000 patients take part, and did send 7,000 bottles for that research, and is possibly now the largest medical cannabis study in Europe, in which LGP is taking part. They also do some clinical research in Australia, close to Sydney. They are located. They are working with Sydney University on a study called Quest. Within that study, there are tested patients. It's about, they did target more than 2,000 and consented 654 patients. 62 doctors are involved in that study, which looks at the therapy of cannabis extracts effects in context with cancer therapy. Yeah. I come to the summary and then I allow questions, of course. History tells us that extracts already very early did play a big role. Of course, then the UN Single Convention did have a negative impact. And as by today, as we see, cannabis extracts play a role with very different significance in different countries. In Germany, at present, extracts are mainly used in pain treatment and still don't play a significant role, whereas dronabinol still is overrepresented. But last not least, within only 1 year, from 2019 to 2020, sales of medical cannabis extracts in Germany doubled to 1 million per month. Biggest player, as I said, still is Tilray in that market. We are still lacking research activities. As a matter of fact, AMP now is supporting one research project in a clinic in Rüdersdorf, close to Berlin, which also will use medical extracts in the pathology and cancer therapy. Health insurance companies, this is a big hurdle from my point of view, still are not recognizing many diseases that can be treated with cannabis extracts. And if we look at other countries, there's a different situation, not only regarding database, but also regarding research activities. So I believe that the trends and challenges will be we will see a fast growth worldwide of extracts in the next decade. I think in other European countries, there are doctors, patients, and research teams forerunners, and the German producers and scientists must catch up with that, as well in research, as well as in development of new products, because I think in the nearer future, flowers still will play a role, but I think extracts on the long run will play a much bigger role compared to flowers and other cannabis products in the medical sector. Thank you very much for your attention. Thank you.